The second generation or third generation's CDS is going to be much more personalized. It's going to take into consideration not only the administrative demographic information about the patient, the clinical data that's being captured by the electronic health record, or the personal health record the patient is submitting data through there, but also what does that patient's genomic profile look like? What is their device data showing? Perhaps that patient who has one of these new hip implants that's going to be able to detect that it's wearing down. Maybe that alert is not about the fact that this patient needs a colonoscopy. We can do those, and we do them all the time. But it's really going to be, perhaps you ought to be getting this patient over to their orthopedic surgeon because their hip is about to need some work. The next generation is also going to be much more about limiting the amount of noise that clinicians have to deal with. Not every alert needs to go to the doctor. You know, I remember a patient I saw, a diabetic patient, where I had 15 alerts go on. What am I supposed to do with that? You know, how do I stratify the ones that are really, really important? So the next generation is going to say, give the top 3 or give the top 5 things that make a difference for this particular patient. Individualized for that patient, and maybe individualized to me. If I'm a provider who does really well with osteoporosis screening, maybe I don't need to see an alert that this patient, this 65-year-old woman, should have a bone density check. It's going to trust that I know what I'm doing. As opposed to another provider, maybe one of my house staff, who needs that alert because they're still learning what they need to do. So it's really going to be personalized to the patient, personalized to the doc. It's going to be given to the right patient. It's going to take advantage of all the big data that exists for that patient, all the learnings that exist in the literature. Maybe it's going to be scouring the literature to look for the next and best guideline that should be applied, as opposed to waiting for someone in the IT shop to design that alert. So I see it as really a very futuristic learning system type of thing that's going to take advantage of all the data for that patient, for that provider that it can.